Good day, everyone. Welcome to another episode of the Drag Queens and Kings show. My name is Alonzo, your host for today. So again, my partner, Velarde, is currently away, so it's just me for now, again. But anyways, today is another special day because I am going to be interviewing someone extravagant. So via phone call. Well, he is a classification of the anti-seizure drugs, another famous drug in the nervous system drug industry. So let's call him now.
Hello?
Hello, Benzodiazepines. It's Therese from the Drag Queens and Kings show. Welcome.
Oh, hi, Miss Therese. Thank you for inviting me to your show.
How are you, Benzodiazepines?
I'm thrilled to be here. I'm just having a splendid time in treating people with anxiety and seizures.
Ooh, time to spill your secrets and saving lives. Can't wait to know more. Shall we?
Yes, bring it on.
Okay, for the first question. As a classification of the anti-seizure drugs, what are the drugs under you?
Well, it's quite a lot. Is it okay if I send it to you?
Yeah, sure.
Well, here it is. It's generic names and corresponding brand names. We have here alprazolam, chlordiazepoxide, clonazepam, diazepam, lorazepam, oxazepam, and triazolam.
Ooh, how about your drug classifications?
Well, for the therapeutic classification, I am used as an anxiolytic which prevents anxiety without causing much associated sedation, and this alters an individual's response to environmental stimuli. And my pharmacological classification is benzodiazepines, anxiolytic hypnotic.
Wow, that is indeed something. I have heard that drugs are categorized according to their effects to a pregnant woman. What's yours?
Yes, that is true. My pregnancy category is D, which means that there is some positive evidence of human fetal risk, but the potential benefits may permit in pregnant women when using me.
Well, that is interesting. How about your mechanism of action in the body? How do you work in the body?
I act in the Limbic System and Reticular Activating System, or RAS, to potentiate the effects of GABA-aminobutyric acid, or GABA, an inhibitor neurotransmitter. It activates the limbic system and RAS, making the GABA interfere with the neuron firing. The GABA stabilizes the postsynaptic cells, which leads to the anxiolytic effects at a dose lower than required to induce sedation and hypnosis.
Wow, mind-blowing. May I ask, where is the limbic system and reticular activating system located in the body?
Well, glad you asked. Both are located in the brain. The limbic system is a set of primitive brain structure located on top of the brainstem and buried under the cortex, which processes reflexive emotions like fear and anxiety. Meanwhile, the reticular activating system is a network of neurons located in the brainstem that projects anteriorly to the hypothalamus to mediate behavior.
Wow. Oh, wonder no more. Thank you for elaborating on that clearly. So, moving on, how does the body respond on you, or what is your pharmacogenetics for that?
I am well absorbed in the gastrointestinal tract with peak levels achieved in 30 minutes to 2 hours. I can also be administered through IM, IV, and rectal. I am a lipid soluble which is capable of dissolving in fats, oils, or fatty tissues. I am well distributed throughout the body, which includes the crossing into the placenta and entering the breast milk. I am also metabolized extensively in liver and excreted in the urine.
May I know what are your indications and contraindications?
I am indicated for patients with anxiety disorders, alcohol withdrawal, hyperexcitability, and agitation, preoperative relief of anxiety, and tension to aid in balance anesthesia. I am contraindicated to patients who are allergic to me, patient with psychosis, acute neuroannular glaucoma, shock, coma, acute alcoholic intoxication, pregnant and lactating women, and patients with hepatic and renal impairment, mostly because it could be exacerbated by certain factors.
I also heard that you have cited adverse effects of the body. Can you tell us more about that?
Yeah, sure. For the side effects, this includes headaches, apathy, lightheadedness, amnesia, confusion, and mild paradoxical excitatory reactions, thrombosis. For the adverse effects in the nervous are sedation, drowsiness, depression, lethargy, blurred vision, sleep driving. Adverse effects in the cardiovascular are hypotension, hypertension, arrhythmias, and palpitation, and for the gastrointestinal, this includes dry mouth, constipation, nausea, vomiting, elevated liver enzymes. Some might experience loss of libido and sexual function.
Wow, benzodiazepines. Thank you so much for sharing us that remarkable insights.
No worries!
So, same as the previous episodes, I did a little research of my own about the nursing responsibilities when you are being administered. Is it okay if I share it to the viewers?
Yeah, sure, fire away!
So, before you are being administered, the nurse should assess the client by doing a history and examination. By assessing the client for possible contraindications and cautions. Second is assessing for baseline status before beginning therapy. Lastly is to perform laboratory tests including renal and liver function tests and complete blood count. Did I get that right?
Yes, absolutely. Please continue.
Okay, thank you. So in identifying the nursing diagnosis, this includes disturbed thought processes and disturbed sensory perception related to CNS effect. 2 is risk for injury related to CNS effects. 3rd is disturbed sleep pattern related to CNS effects. And lastly is deficient knowledge regarding drug therapy. And in planning, the nurse should be made aware that the client will receive the best therapeutic effect from the drug therapy and that it will have a limited adverse effect to the drug therapy. And the nurse will also make sure that the client or patient will have an understanding of the drug therapy, its adverse effects to anticipate, and measures to relieve discomfort and improve safety. Now, during administering you, the implementation includes not administering intra-arterially because serious anterior spasms and gangrene could occur. Not mixing IV drugs in solution with any other drugs to avoid drug-to-drug interaction. Give parenteral forms. Give IV drugs slowly, then arrange to reduce the dose of narcotic analgesics in patients receiving you. It's also important to maintain patients who receive parenteral benzodiazepines in bed for a period of at least 3 hours. Next is to monitor hepatic and renal function as well as CBC during long-term therapy. Taper is important. Taper dose gradually after long-term therapy, especially in epileptic patients. And also, it's important to provide comfort measures and provide thorough patient teaching. And after you're being administered, the nurse will monitor the patient's response to the drug, monitor for adverse effects, evaluate the effectiveness of the teaching plan, and support parents as appropriate. And lastly is to monitor the effectiveness of other measures to support and stabilize the patient. So I guess that ends there. Benzo, my man. Benzodiazepines, are you still there?
Yep, I'm still here.
So did I say everything right?
Yes, fabulous. Everything was on point. Hopefully our viewers learned something today.
Oh, thank you. Yes, I think our viewers definitely learned something today. Thank you so much for being with us today and for gracing the show with your presence.
No worries. Such a pleasure. Thank you also for having me.
Give it up again to Benzodiazepines. Okay, guys, that's it for today's show. Thanks for watching. Stay tuned on our next episode. This is Therese from the Drag Queens and Kings show, signing off. Bye!